Welcome to Ararat Healthcare and Charkos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charkoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay, you're achieving your dreams any longer and sign up now.
Hello everyone, this is Dr. Seema Palyan, and I'm here to discuss Oral Care Plan today. As we all are aware, Oral Care Plan is one of the new stations which have been added to the adult OSCE. Oral hygiene or oral care is one of the key aspects to look after the patient and to maintain a good patient care. So it is an important station and we will be discussing about it today. For the OSCE, this station is going to come under the skills stations and it is going to be a silent station, which means that it is only going to be a written station. You will be given 8 minutes to complete this station, in which you will need to complete an oral assessment chart accurately and then write an oral care plan using your findings. You will be using a black pen to complete this station. Make sure that your writing is clear and legible and you complete all aspects. Please do not rewrite, overwrite or cross out if possible. If required and if you have to cross, then a single cross with your initial on the top is acceptable. As we discussed, you will be given or you will be required to complete an oral health assessment tool. On the right side of your screen, you can see that there is an oral health assessment tool picture. Now, as per this picture, there are different aspects of the oral health that you can see, which will include the health of the lips, the dental pain, the oral cleanliness, your teeth, dentures, if there is anyone who has dentures, how moist your oral mucosa is or the status of the saliva, your tongue, gums, and the tissues. So this oral health assessment tool is used to make sure that the patient oral hygiene is maintained. It is also going to let us know that how well the hygiene is maintained and whether the score, of which you can get a maximum of 16 score, that you can get, and the higher the score, the unhealthy the oral hygiene is. So there are 8 parameters which we have discussed, and the score is given from 0 to 2, where 0 is healthy and 2 is being unhealthy. You will be given either this oral health assessment tool for the OSCE. It is most likely going to be completed for you, and you will be able to assess that how well the oral hygiene of the patient is. There is also going to be a scenario which will be given to you. Based on that scenario, you will need to make an oral care plan for the patient. What can you expect in the OSCE exam? Now, as we have discussed, that in the OSCE, you will be provided with a scenario. Now, currently, there are 4 scenarios, out of which you can get any one scenario, of which you will then need to write an oral care plan for. The 4 scenarios are: there is a critical care scenario, there is a learning and physical disability scenario, there is a cancer treatment scenario, and then there is an end of life scenario. You will need to complete the oral assessment chart and then write the care plan accordingly. To achieve full marks, you will need to identify a minimum of 6 aspects of the care and write them down. We have tried to break down the 6th aspect of the care into a mnemonic, which is going to help you to memorize and to remember things easily. So the mnemonic is TRILAR. Now, this is something that we have created just to help you a little bit. If you wish, you can make your own mnemonics as well. The TRILAR basically deals with T is for teeth, R is for rinse. Your oral hygiene can be maintained with many kinds of oral rinses, whether it is a chlorhexidine or whether it is just with plain water. And I is for eyes and hydration. L is for lips. A is for that there is any other additional needs. And R is for reassessment. So altogether, these makes the 6 point, and these should cover all the 6 aspects of oral care that you will be required to write down in this station. Now, as we discussed that there are 4 types of scenarios which are there, we are going to be discussing the scenarios one by one, where we are also going to go through the criteria, what you will be supposed to write in order to gain complete marks in this station. The first scenario is for critical care. Now, we all know that when the patient is in the critical care, the most important and the most common complication that can happen is the ventilator-associated pneumonia. And hence, it is very, very important that we avoid that, and adequate precautions are taken in order to make sure that the patient stays healthy. So when the patient is in the critical care, the most important aspects of oral hygiene are that you will need to make sure that the patient's teeth are brushed twice daily, brushed or cleaned twice daily with a compact-headed toothbrush or a suction toothbrush. We are supposed to use twice daily chlorhexidine mouthwash to rinse the mouth and to reduce the risk of ventilator-associated pneumonia. Also, it is very important to make sure that the oral moisturizer is used to make sure that the oral mucosa and the lips, you can use the lip balms, that we are using them to keep the oral mucosa and the lips healthy. We have to make sure to minimize the traumatic ulceration caused by the endotracheal tubes by using the specifically designed fasteners or bite blocks. And also, it will be important to alternate the tubing from side to side. To reduce the risk of aspiration, the suction is required and it has to be used as and when the need is. Also, it is very important to identify the need for reassessment at least every 8 hours. If there are any other aspects of care which are required, then you need to make sure that those are identified as per the evidence-based practice and they are also looked after. So all these are the aspects which you are going to be required to use and write and to think about when you are writing the plan for critical care patient. Then the second scenario is the patient who is having a learning and physical disabilities. Now, again, the TRILAR mnemonic is going to be used over here as well. So as per the TRILAR, teeth are our first aspect. So hence, twice daily teeth cleaning with soft, compact-headed toothbrush or electric toothbrush is required. Since the patient with the learning disabilities or physical disabilities are able to help in the self-care, you will be encouraging the patient for self-care using foam handle to assist with holding of the toothbrush and pump action toothbrush. Regular oral mouth cleansing and swabbing or hydration using the ice chips or the sips of water throughout the day is required. Mouthwash should be encouraged if the patient is able to tolerate it. Again, we need to make sure that the lips are kept clean and moist using the moisturizer or the lip balm. The face should be wiped regularly, minimizing the moisture on the skin, and then use the moisturizer or barrier creams on the lower jaws to protect if there is any drool from the mouth, to protect the skin from the drooling. Again, the last aspect is going to be that you will need to identify the aspects of care that is relevant and evidence-based and the requirement of the reassessment of the patient. This brings us to our third scenario, which is the patient with cancer care. So again, in this one as well, it is the teeth come as the first aspect of oral hygiene, where we will be required to use the twice daily teeth cleaning with soft toothbrush. And if the patient is able to tolerate the soft toothbrush or the other kind of toothbrushes, twice daily chlorhexidine mouthwash if the patient is able to tolerate. Then regular oral cleansing and hydration using the ice chips or the sips of water throughout the day. Make sure that you apply oral moisturizer to the oral mucosa and the lip balm to the lips every 2 to 4 hours. Use of artificial saliva is also important. As you know, with cancer care, a lot of the oncology medications, they have a side effects of dry mouth. Hence, it is important that the need for artificial saliva is recognized and it can be used. Also, we need to be aware that there can be a lot of pain in the oral mucosa. Sometimes there is ulcerations as well. And hence, if the patient is having pain in the mouth, then we need to offer some analgesics. And the 8-hourly reassessment of the patient should be done. And also, if there are any other additional factors or aspects of the care which is relevant and evidence-based, that needs to be added to the oral hygiene as well. Now we come to our last scenario, which is the end of the life care. Now, again, majority of the ways of you to maintain the oral hygiene are going to remain the same. And we start with the teeth. So twice daily teeth cleaning, or if the patient is having dentures, then twice daily denture cleaning with soft toothbrush is important. Twice daily chlorhexidine mouthwash, if the patient is able to tolerate it. A regular oral cleansing and hydration, and we can use either the spray or the dropper or ice chips or sips of water throughout the day. In the night, please make sure that the dentures are removed and they are soaked in the cleansing solution. The lips should be kept clean and moist using the moisturizer or a lip balm, but not the petroleum jelly or Vaseline, as majority of these patients are likely to be on oxygen. Again, we need to identify the need of reassessment of oral hygiene at least every 8-hourly. And if there is any other aspect of care which is relevant and evidence-based in addition to the above mentioned one, then we need to take that into account. So this completes our 4 scenarios and also the aspects or the criteria that are required for you to be writing in order to make sure that you have completed the oral care plan. Now, I would be taking you through one of the oral care plan that we have written as an example. So if you see on the left-hand side of your screen, there is a scenario and the type of scenario which you can expect in the exam. So you are going to get some instructions where it is on the scenario, which will tell you that it is a silent station and that you have 8 minutes to complete all the documentation that is required, and that you will need to complete an appropriate oral care plan for your patient, identify a minimum of 6 aspects of care to help reduce or prevent further oral hygiene complication based on the given scenario. You will have a scenario which will have the patient's name, date of birth, hospital or NHS number, and the ward or the GP's name. Now, the scenario can be one of any 4 types. We have now taken a scenario of a patient who is currently in ITU or critical care patient. So on the right-hand side of your screen, you will be able to see the format or the template of the oral care plan. On the top, you are going to have a section where it is going to be the patient's name, date of birth, and the hospital number and the GP's name. After that, there is a place where you will have to write the problem. Now, in this scenario, if you can see, the problem we have chosen for the patient is that Kerry's is at high risk of ventilator-associated pneumonia, as evidenced by her being on the ventilator support and high sedation. Our goal or aim of the care is that Kerry's will be free from risk of ventilator-associated pneumonia, and her oral hygiene will be maintained as per the ITU guidelines. The interventions that we are going to be doing in order to achieve our goals are going to be that Kerry's teeth will be brushed twice daily with soft, compact-headed toothbrush or suction toothbrush. She will have twice daily chlorhexidine mouthwash. Kerry's oral mucosa and lips will be kept moist by applying oral moisturizer and lip balm. Specifically designed fasteners and bite blocks will be used to minimize the traumatic ulceration to Kerry's oral mucosa. Also, the tubing will be alternated from side to side. Kerry's will have a regular suction to prevent aspiration. She will also have a regular assessment for oral hygiene every 8 hourly. And if we have identified any other aspect of the care, they will be included and identified as per the evidence-based practice. Last but not the least, you will need to sign and date and time. You will need to add the date and time of your care plan. So this is one of the examples that we have taken in order for you to know that how you are going to be writing the care plan according to the scenario that you will be getting. So I hope that you will be finding or you will find this session useful, and that you would have understood that what is this new station all about, what is oral care plan, and how you can write the oral care plan and what to expect in this station. So thank you very much for watching, and good luck for your exam.